If we turn to statistics, it will be now that migraine affects about 10–13% of the world's population. It is usually observed in young women. The disease is quite serious as it significantly reduces the quality of life of people suffering from it. During the attack, the patient was to give up everything because the pain of migraine is unbearable. It is impossible to tolerate it. Migraine attack lasts from a few minutes to several hours or even days. At this time, patients experience intense headaches, mostly unilateral, which can change their localization. That is, it hurts then the right, then the left half of the head. The pain is accommodated by photophobia and intolerance of loud sounds, which cause a person to be isolated from everyone in a closed dark room for the duration of the attack. Migraine itself is not dangerous, however you need to know all the complications that it entails. In order to understand this, you need to understand the pathogenesis of the disease, that is, what happens in the body during migraine. These headaches are associated with the expansion and the narrowing of the valves of the brain. Will the vessels constrict, the brain structures do not receive sufficient blood sampling. That any ischemic zone is formed. This zone slowly moves through all parts of the brain. Because of this, the pain changes its localization. Lack of blood circulation lasts about 4–6 hours, which is quite dangerous for the brain. Migraine can be chronic if the pain lasts 15 or more days per month, which leads to the fact that the patient cannot lead a normal active lifestyle. In order not to start your disease, you need to be thoroughly examined by a neurologist by passing traditional methods of examination. This include an MRI of the brain, ultrasound of brain waves, X-ray of the skull and spine. Signs of a migraine becomes a Kyznetsova disease with only of pathologies that increase the intensity of the headache. Chronic pain can become with the abuse of drugs that relieve headaches. This happens in case where people suffer from medication from migraine. Do not go to a specialist and prescribe treatment themselves. Often it is wrong, so it does not bring relief during attacks. As a result, patients use more and more drugs. Also, often by mistakes, patients take ordinary pain pills, among them analgin and its derivatives. The use of analgesics can only relieve the usual headache for a while. In order to avoid complications, you need to follow a few simple rules. At first things of any interest of headache, consult a neurologist. Even if you have pills, you need to identify the cause of pain because they do not arise just like that, and painkillers are not able to cure the cause, removing only for a while the symptoms.